Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about the most requested topic, and apart from that, it is a topic which is most misunderstood, and many girls are suffering from this disease. This is nothing but hirsutism. So what is hirsutism? How is it caused? Is it only caused in PCOS, or are there other conditions which are causing this hirsutism? Do only females get affected by hirsutism, or even males are affected by it? What are the tests to be done to know about this hirsutism, and what are the best treatment options? We will be knowing all of this in this video. So let's dive into the topic. So what is hirsutism? Hirsutism is a condition that causes excess hair growth, that to thick and dark hair growth in certain parts of your body. It mainly affects females. That means it also affects males, but it is really hard to distinguish hirsutism in a male because they already have a lot of beard, they have mustache, they have hair on their chest. So it's hard to distinguish hirsutism, but it is easy to distinguish hirsutism in females because females are prone to have very thin hair. Okay, so even males are affected by hirsutism, not only females, and also it has different causes. What is hirsutism? It is nothing but unwanted hair growth in different body parts because of different conditions. Majority of the conditions point out towards PCOS. So who are affected by hirsutism? Hirsutism, you have to understand that females as well as males are affected by hirsutism, but it is most easier to distinguish in females, and people who are having a family history of hyperandrogenism or having a family history of this thick, dark, coarse hair are also affected by hirsutism. And then it not only affects adults, it affects children also. Yes, see, these days children, especially girls, are attaining their menarche, which is their first menstruation, in very early ages. Usually girls used to attend their menarche in 12, 13, 14, 15 years. But these days, if you take the statistics, girls are attending their menarche at 8 years of age, at 7 years of age, at 10 years of age, which is usually early. There are signs where they point that this girl can have early menarche. What are that signs? Unwanted hair growth, especially in the mustache area, developing of mustache or the side locks, which are really thick. If your child is developing these kind of hair growths really faster, that means she has a tendency of hyperandrogenism, and she will develop this secondary sexual characters really faster, and also she can in future suffer from different diseases like it can be Cushing syndrome, it can be PCOS, it can be PCOD, it can be any sort of hormonal disturbances also. So if your child is starting to develop the thick coarse hair very early, then you have to understand that you have to make her eat less amount of fatty food, that the fatty food has to be decreased. Let her or let him and work out a lot, and also decrease the stress level if there is any. Try to give a lot of love and care, and make them healthier so that in future they will not be suffering with any of these problems. Apart from that, people who are residing in Mediterranean region, South Asian regions, or Middle Eastern regions are also prone to get this hirsutism. What are the symptoms of hirsutism? See, hirsutism is depicted by thick, dark hair growth. Okay, it's not just hair growth, it is thick hair, it is dark hair. The hair is really thick compared to the normal hair that we have, and also it is very dark in nature. Okay, that is a main symptom. Apart from that, there is a subtype of this hirsutism which is called as virilization. Whenever there is too much of androgen levels in the females, what happens is there is lot of secondary sexual characters developing which are not of females but are of males. See, what are the secondary sexual characters of females? It means that they will start menstruating or attain menarche. Second, their breast size will start increasing, and also their voice will become high pitched. But in males, contrary, what will happen? Their voice will develop really bass kind of a voice. Their voice will get deeper, and also there is no increase of any breast size here in males, and they develop mustache or they develop this hair growth. Okay, but what happens in virilization is that the females who are supposed to develop secondary sexual characters will develop secondary sexual characters of males. That is, what is that? That is nothing but getting deeper voice. Usually females will have this shrill, that is high pitch voice, right? But females who are suffering with hyperandrogenism or this hirsutism, can develop deep voice or bass voice. Their breast size should actually increase when they are having secondary sexual characters, but it will start to decrease breast size and increased muscle development. Usually females have more of curvaceous body, whereas males have more of prominent bicep tricep region. Okay, there is increase in muscle development also. Okay, and then the clitoris, which is the region where your vagina is covered by two lips called as labia, and on the topmost part you will be having the clitoris. That is also increased. There is increased sex drive and there is acne. All of this will come under secondary sexual characters of males, but they are developed in females. So there is deep voice, decreased breast size, increased muscles size, clitoris enlargement, increased sex drive and acne. Then coming to the causes. So what are the causes of hirsutism? The first thing you have to understand that hair follicles are very sensitive to androgens. Okay, so are they very sensitive to, if there is hyperandrogenism, you will be developing lot of unwanted hair growth and the hair which is supposed to be on your scalp will start falling down. Polycystic ovarian syndrome is a common factor for hirsutism. Apart from that, post menopause where the estrogen level drops, there also you can experience hirsutism. And Cushing's syndrome. What is Cushing's syndrome? Cushing's syndrome is hyper or increased or abnormal levels of increased cortisol levels, where the face will be moon face, that is too much of puffiness. Today we are getting a lot of Instagram reels saying, you know, this is my cortisol face before and now I've changed into something else or I've changed into a better person. So that puffy phase is called as moon phase, okay, and that can be developed. There can be stretch marks. Usually stretch marks are found in whom? They are found in individuals who lack proper protein, they have lack of collagen, or they develop in people who are during pregnancy the stretch marks develop, and also they develop in people who are starting to gain a lot of weight suddenly or decrease a lot of weight suddenly. Okay, in Cushing syndrome, what will happen is that the person who is suffering from Cushing syndrome will start to accumulate a lot of fat and water and grow abnormally large in a shorter period of time. That's why they will be having stretch marks and easy bruising. And also one important feature that everybody forgets is the buffalo hump. What is buffalo hump? See, the back is usually straight. Okay, so what happens in buffalo hump is there is a lot of deposition of fat in this area, and there is folds happening in the neck. Neck usually will not have a lot of folding. Okay, folding will be there because we move our neck, but the folding should not be thick skin. Okay, if there is thick skin, if there is buffalo hump, if there is blackness here, and if your head is a little bit protruded out or protruded like this, forward, that can be a sign of high cortisol level. Do not neglect these signs if you're finding it in yourself or in your children. So in these conditions also hirsutism can develop. And adrenal gland tumors, if you have adrenal gland tumors also you can develop hirsutism. Apart from that, if you are using a lot of medications, different people have different triggers for different medications, but the most common one is Rogaine and minoxidil. If you are using minoxidil for a hair fall, remember to evaluate what is the cause of this hair fall. If it is hyperandrogenism, target hyperandrogenism and not use a lot of minoxidil, because minoxidil can trigger hyperandrogenism. Okay, not directly but in an indirect cycle. So if you're using minoxidil 2% or 5% for a longer period of time, try to understand that this can also cause a certain amount of spike in your androgen level. So try to know what is the proper cause of your hair fall and then treat the cause, so that your hair fall will become a little bit, the hair fall will come down and your normal hair will start to grow. Then the most asked question is, do all PCOS patients have hirsutism? No. If you're taking 100 people who are suffering from PCOS, 80% people do have hirsutism and 20 to 30% people might not suffer from hirsutism. So what are the tests that need to be done to understand or to know hirsutism? The first and foremost is hormonal profile. You have to get your estrogen, progesterone, FSH, LH done, that is normal. What extra tests should you be getting done is prolactin, because hyperprolactinemia can also be a sign in some cases of hyperandrogenism. So you have to get prolactin done. You have to get DHEA sulfate, which is dihydroepiandrosterone test done. Apart from that, and also you have to get your testosterone level also checked. Okay. So apart from that, you have to get your thyroid profile done, because hypothyroidism and sometimes trigger PCOS, which can trigger hirsutism. And then HbA1c to see if your insulin resistance has been converted into type 2 diabetes. And also hyperlipidemia. Lipid profile is very important because children, if they are suffering from hyperlipidemia from a very young age, try or they tend to have a lot of lifestyle disorders like PCOS. They can have PCOD, they can have type 2 diabetes, they can develop hypertension at a very early age. So that is also very important. USG scan, as we have already told. And if there is no problem in anything but just your DHEA level and your testosterone increase, then get an CT and MRI of the adrenal gland to see if there are any sort of tumors. Then, if you're someone who's suffering from hirsutism, and if you do not know if you're really suffering from hirsutism or not, we have to get this score done, which is Ferriman Galway score, which is very easy form. You can just take a paper, note down while I'm telling it, so that you will know if you're suffering from hirsutism or not. This is a score to assess the hair growth. It assesses the hair growth in 9 different body parts. That is, 9 different body parts are taken, and each body part is given 1 to 4 score, okay, or 0 to 4 as we can mention. And then if the score is more than 8, that means you are suffering from hirsutism, okay. So let's just see, or it is an indicative of hirsutism, and then you can get your hormone level tested to see if you're really suffering from it or not. So what are the 9 body parts and how do you score 0 to 4? The first body part is the upper lip, as you can see. If you're someone who is having very fine hair, it's not thick, it's not coarse, it's not dense, it's very fine hair, and if you're standing in the mirror 3 to 5 feet away from the mirror and you're not able to see anything, then probably you might not be having anything. That is a 0. But if you're having thick hair, even 1 or 2, or very less number, you can give a score of 1. If it is more than that, you can give a score of 2. If it has covered both your upper lip, lower part of your upper lips, then you can give 3. If it has covered even the upper part, that whole upper lip also, then you can give 4. Okay. If it is very thin, then 0. Then based on the pictorial representation, you can rank it from 1 to 4. Then the second one is chin. 1 or 2 or at least 5 to 6 or at least 10 hair growth is okay, that you can give 1. Too much than that is 2. And then if it is increasing, you can go to 4. First is upper lip, next is chin, and next is the chest area, and then the abdomen, upper abdomen area, usually this area. See, many females will be having hair. I don't say that you should be giving some score on it. If the hair is thick, dense, dark, then you should be giving a score from 1 to 4. If it is not thick, if it is not dark, then you can give a score of 0. And then after upper abdomen, you can go to lower abdomen, okay. And then from lower abdomen, you're going to hands, okay, the hand part, as you can see. Then the thighs, thick dark hair on the thighs. Then upper back, okay, and then lower back. If you're someone who feels like you have excess amount of hair growth, you can assess through this and you can give your scoring for 9 different body parts, and combined everything. If your score is more than 8, that means you have an indication for hirsutism and you can get your hormone profile done. Now coming to the conventional form of treatment. So if you are suffering from hirsutism, and mostly people who suffer from hirsutism, 80% of cases of hirsutism do point out to PCOS. So usually what allopathic form of treatment or what your gynecologist will suggest for PCOS and hirsutism, let us see. First is hormonal contraceptives, second is anti-androgens, third is low dose testosterone, fourth is GnRH agonist or antagonist. Okay, whenever you are taking these kind of medication, you have to remember that GnRH medications usually do create a menopause kind of stage in your body or state in your body, where if you are trying to get pregnant, or if you are recently married and trying to get pregnant, or if you are a person who is going to get married, this kind of medication might not be the perfect kind of medication for your condition, and also it does not cure anything. Secondary is low dose steroids as well as anti-androgens. As long as you're using these steroids and anti-androgens, the condition will be under control, and as soon as you stop it, the condition can escalate. Okay, and the third one is your hormonal contraceptives. The hormonal contraceptives have their own baggage of side effects like weight gain. They can cause your skin to become dry, dark, dull. They can cause acne. They can cause hair fall. They can cause a lot of other hormonal imbalance also. Until if the proper medication is given, even though if you are feeling right now much better, as soon as you stop the medication, the condition can revert back because there is nothing done to the cause that is causing it. It is only the allopathic form of medication is only suppressing it or maintaining it, as we can say. So in order to get a proper cure, there is nothing in allopathy which is pointing towards cure. And apart from that, for your hirsutism, we have the skin creams, we have electrolysis and laser removal treatments. As soon as you stop these treatments, you will again have regrowth of hair. But people might be asking, ma'am, laser treatment is like the OG for hair removal. Yes, it is an OG for hair removal, but if you ask a laser technician, or your dermatologist will be suggesting that it will take usually 10 to 12 sessions for a normal female to get rid of hair. And even after 12 sessions, 90% of the hair will be gone, but 10% here and there can appear, which you have to take it away through razor. But people who are having continuous amount of high androgen in their body, what will happen is even after 12 sessions, you will not see much noticeable results. If you're asking your dermatologist, she will suggest first you have to treat your excess androgen, and along with that, if you get a laser treatment done, it will give much better result. So understand that laser removal treatments are good option when you have low amount of or proper amount of hormonal balance. Whenever there is imbalance or whenever you are suffering from hormonal imbalance and high excess androgen level in your body, these treatments might not give 100% results as you are expecting them to give. Next, coming to the form of treatment which is safe, which will prevent further recurrences, which will connect the link and understand the cause. That is nothing but homeopathic form of treatment. In homeopathic form of treatment, what we actually do is, see, we are correcting the link. Where is the cause happening? Is it hereditary? Is it some problem in the GnRH pulsations? What is the stress which is causing that? Any sort of high cortisol? We are connecting the stress. We are connecting your physical symptoms. We are connecting the outcome of the physical symptoms. We are connecting how you are affected by the physical symptoms that you have developed, and we are giving a medicine which will affect you holistically, removing that original disease. It will cure you. It will understand the link. It will balance out your hormonal fluctuations. By balancing the hormonal fluctuations, your hirsutism will decrease, your excess hair growth will decrease, the recurrences will decrease. Even if you're getting a laser hair removal treatment done, the treatments will give absolutely beautiful results. So by taking homeopathy, it is effective. It does not have a side effect baggage. Okay, it is timely. You should be taking it for a period of time. It needs some action. So you should be taking it properly, and then understanding the link, providing you with a less recurrency rate. You're curing the condition, you're relieving the symptoms, and you're preventing further recurrences. So this is the best option for any sort of lifestyle disorders that are appearing today. It is the best sort of treatment method for any sort of lifestyle disorders that are appearing today. We have talked how homeopathy is in the upper hand coming to this lifestyle disorders or this PCOS or this hirsutism. And homeopathy, Fidicus homeopathy is the best choice. Here we have two kinds of consultation options. One is the online consultation option, second one is the offline consultation or in-person consultation option. Okay, if you're staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're staying far away from us, you can contact us online, and you can contact us either through audio consultation option or through video consultation option. And after consultation, after the case is taken and the investigations are verified, especially to our online clients, medicines will be door delivered to you. If you're staying in India, 3 to 4 business days, USA 3 to 5 business days. Apart from that, across the globe, anywhere, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can contact us on this number, call us or WhatsApp us. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. We have talked how homeopathy is the best option for PCOS or PCOD or for female reproductive organ diseases or for this lifestyle disorders. We will be talking how Fidicus Homeopathy is the best option in homeopathy. See, Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. The first one is we are already experiencing high success rate in female reproductive organ diseases like fibroids, bulky uterus, PCOS, PCOD, dysmenorrhea, endometriosis and cervical erosion. We have high success rate in these kind of cases. Apart from that, the treatment which is given here is transparent. That is, there is no gray area between the patient and the doctor. Here we will be explaining the prognosis very clear to you. And then the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, any sort of myths, any sort of questions that you are having, everything will be answered to you. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.